Hi, I'm Dr. Nima Nabavizadeh, Associate Professor of Radiation Medicine at OHSU. I'm here to discuss the key takeaways from the primary analysis of the PATHFINDER 2 study, the largest interventional multi-cancer early detection, or MCED trial in the United States. These results were presented at the American Society of Clinical Oncology 2026 Annual Meeting. The PATHFINDER 2 study assessed the performance of the Galleri MCED test. It enrolled over 35,000 people in North America over the age of 50 with no clinical suspicion of cancer. The Galleri test was able to increase the cancer detection rate by 6.5-fold when combined with recommended screenings for breast, colorectal, cervical, and lung cancer. When you include prostate cancer screening, the Galleri test increased cancer detection rate by nearly 3-fold. Over half the new primary cancers identified in the PATHFINDER 2 study were stage 1 and 2. About 71% of the new primary cancers diagnosed were between stages 1 and 3. About 68% of all cancers detected were types without U.S. Preventive Service Task Force grade A, B, or C screening recommendations, which include screening for breast, cervical, colorectal, lung, and prostate cancers. These are cancers that would have likely gone undiagnosed until they became symptomatic. Performance results in the PATHFINDER 2 study were consistent with previous studies of the Galleri test in the intended use population. The positive predictive value was about 60%, meaning a cancer signal detected result most likely resulted in a cancer diagnosis. Across all cancers, Galleri correctly identified the cancer signal origin in about 91% of signal-positive tests, helping lead to a highly efficient diagnostic workup for both the patients and the providers. Of participants with a positive MCED test, the median time from test result to diagnosis was 48 days, a relatively quick time frame which allowed providers and patients an opportunity to treat the cancer as quickly as possible. Galleri continued to have a low false positive rate of less than 0.4%, helping to minimize unnecessary workup. 0.6% of all participants had an invasive procedure, 90% of which were non-surgical. The Galleri MCED test had a very favorable safety profile, and there were no serious study-related adverse events. MCED tests have potential to transform cancer screening, but that depends on strong performance and rigorous clinical evidence. The PATHFINDER 2 results add to the evidence supporting Galleri's robust performance and safety in a diverse and representative intended use population. Screening for cancer with standard of care recommended screening tests is an important part of staying healthy. These findings suggest that in addition to recommended screenings, the Galleri test can help identify many cancer types for which we don't have screening, when treatment with curative intent is possible.
The Galleri test is prescription only. The Galleri test is recommended for use in adults with an elevated risk for cancer, such as those age 50 or older. It is not recommended for individuals who are pregnant, 21 years or younger, or undergoing active cancer treatment. Galleri should be used in addition to routine cancer screening. Galleri does not detect a signal for all cancers. False positive and false negative results do occur.